Hey everyone, we're going to cover a hip case today and show you some exercises that we used in her care to make her feel 100% again. The case that we're talking about today specifically was with someone about 45 years old roughly. So it was someone who wanted to snowboard and ski again, being able to hike, walk her dog, and she woke up on her side an exhausting amount of times during the week, which is about 4 to 5 times she woke up on her side and felt the hip pain. Go ahead and go into your kneeling position for me, Dawn. So the area we're talking about where she had the pain at was just on the side here and a little bit into the front. Important notes is she had a normal hip exam and she had a normal MRI. So we're going to cover these aspects in the video today. I'm Sebastian and this is Dawn. We're part of the locally world-famous chiropractors in Costa Mesa, California. Go ahead and line your back for me, Dawn. I'm going to show you some of the examination that we did with her, which, go ahead and scooch back to me a little bit. We've done this in some of the other videos that we've had, and but it's important to note that when someone has a normal hip exam, because no one's going to be really normal, it's just normal side to side, that it's important to identify that there may be other things creating their problem. And so basically, we want to feed her hip up into her shoulder. We want to turn her foot over to my body. We want to turn her foot over to the camera, and then we feed it up into her shoulder again, and then I can tell this is going to hurt her already. And so I'm going to try to drag her knee across her body really slowly to her opposite hip. Let's see her eyes start to water. So is this the problem where you have sides on?
Yeah.
I picked the wrong one. So, and another one is you're going to go like this, and you can also lay it down like so, okay? Important parts that we had on this lady's exam is that she had generally normal hip range of motion, and all the muscle testing, push into me, good, foot down. Oh, you want to go the whole thing?
Oh.
Push into me, pull into me, foot down, push into me, push into me. Like all of the normal testing of the musculature was basically there. And so she has a normal hip exam, especially according to the other side, which leads to the possibility that she's just using the muscles of her hip a little bit too much. And so in her examination, we found out that was all basically normal. Her MRI was normal. She's clear to go. She can do some rehab, and that's what we did.
What would abnormal look like?
Abnormal, that's a good question. Go ahead and bring your head over here. And so usually the range of motion changes a little bit. This doesn't always hurt, but an abnormal one would be if I were to feed her up into this position here. We got a line from here to her shoulders, which is kind of straight, and I can kind of push her like freely, right? There's nothing really restricting me. Now, if I push her up and then go ahead and drift, yeah, so this kind of stuff happens. Like, it doesn't have to be this dramatic, but there's nothing I can do to feed it up into that line. And that's going to be more of what we call Dremann's sign, which is a sign of arthritic formation, maybe a labral tear associated with maybe clicking or popping, and maybe trauma. But also, too, if you have this, it doesn't mean that this is your symptom generator. It just means that it's not normal. Some people have this presentation where they don't really have any pain in the hip in the front. They have it in the back or the back of the hip, which indicates that it's probably something else. There's other small musculature just working. But that's basically an abnormal one. Another abnormal one would be if the range of motion was dramatically reduced in internal rotation as compared to the other side. We have to make sure that we're comparing side to side because what's normal for Dawn is not what's normal for me, okay? So she was using the muscles of her hip a little bit too much, specifically the hip flexor, and so we decided to take more of a core approach with her, a core and a hip, a healthy hip type of approach with her. What that means is we need to stiffen the core to build a little bit of the core support, but also that helps out to improve the function of the hip overall, the happy hip. And we have to get the glute max to become involved, as well as the glute med and the glute min, all the glutes. And so I'm going to show you how we did that today.
Cool.
Now, before we go into those exercises, though, she did need one thing to actually help her out to make it so the exercises were possible. Dawn, I'm sure you've seen with some people that you try to give them something like a hip exercise and they just can't do it because there's something obstructing, okay? And so oftentimes there's a precursor step that's required. We did something called a side opener with her. Go ahead and grab that thing over there and set it up so your right side symptom is up. So Dawn's going to set up the side opener, which we did with her. Perfect. And all she's doing is opening this side of the body here, all right? Sometimes the musculature here is a little bit too tight, and just opening the area for about a minute or so is enough to unlock the potential of the core in the hip. And so she did this, and I coached her to breathe into my fingers. Good. As you're breathing into my fingers, I want you to imagine there's a tide, like you're at the beach. Tide's going in, tide's going out. Okay? So you're going to breathe into the tide. It's going to move both fingers away from each other, and so on. Now this really helped her. She actually stood up and she was able to walk without having any pain, surprisingly, right? By the way, that we cover it in the webinar of why this happens. It's in the corner. But also what really helped her out, what we noticed, was creating a little bit of tension against my fingers. So can you push my finger away with your insides? There you go. Even if you're exhaling, keep my finger away. So this essentially shortens your tide, right? You're still breathing. There's still tide happening, but your tide shortened, okay? And so this is what we call improving intra-abdominal pressure, which is a part of the core. And this helps out to build the internal pressure of the core, so then we can challenge the remainder of the core muscles and the hip in a favorable way. Go ahead and throw this thing aside.
Why would you choose this compared to maybe any other things to relax the muscles of this side?
Mainly because we found that with her hip in particular, when she leaned towards this side, it increased her symptoms. When she walked, she actually buckled into the side a little bit. And so the theory is that why not just do the opposite, okay? And do the opposite, build a little bit of internal pressure coaching associated with it, and then we can use that coaching type of strategy as we go through the exercises too.
Makes sense.
Okay, go ahead and face down. We're going to do something called a hard style plank. I like the way you coached this last time, so I'm going to take that from you. Go ahead and slide towards me. Okay, so here's the important part with this. Actually, this is why I want to share this case with you today, is that she was a really interesting situation where we gave her core exercises like this, but if not coached with pressure, it didn't help her. Actually, she felt worse. And we'd get a call the next day about how bad that she felt. And then when she would come in and we'd coach it with pressure, she felt fine. And the next day when she did it, actually I should note, when she did it on her own, immediately after she did it, she felt worse. And so she essentially had to start icing her hip after she did the exercises, which is not an optimal situation. You should not have to do exercises that hurt you. And so when we coach the pressure, push your guts into my fingers, and then push me up, push me up, push me up, push me up. One more, push me up. There you go, stay right there. And keep pressure in my fingers with that little tide breathing. Come on down. So this is really hard for her, okay? It's hard for a lot of people. One more time.
It's not
pressure.
hard.
It looks hard.
It is.
Push me up, 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 push me up. Stay right there and breathe in my fingers, okay? And this is probably about the whole amount of time that I would take Dawn through. Go to relax. I do have her do more reps. But overall, here was the interesting part with her case. We saw this lady a total of 8 times over the course of about three months. I would say around the 6th time, we finally said, when she's walking, she has pain, and we do the opener, and she'd feel better. And then she's like, why does this keep happening? And we're like, well, can you just put a little pressure into my finger as you walk, or your own fingers in that case? And she's like, holy, it went away. She can do anything that we asked her to do. As long as she kept pressure, her symptoms went away. So the next time we saw her, she was so happy because she was able to double down on the concept and just focus on this pressure, and actually her symptoms went away dramatically at that point.
Why do you think that is?
Because she wasn't paying attention to the pressure, okay? And if she wasn't keeping pressure, how can you get the hip to stay online? How can you get the glute to stay online? How can you get the abdominal wall to stay online? We have a whole webinar on this. As I mentioned, I won't go through it in too much detail. But the problem is that she was focusing on the burn of the exercise and not actually the pressure, okay? And so for her, the pressure was going to be really important. Over the course of time, as we started to build up the things that we wanted her to do, all the green light exercises, she still had a lot of things day to day which were red light. They increased her symptoms. At least, though, I can say that probably after the 2nd session, she stopped waking up 4 times a week.
Nice.
Yeah, so at least there was day-to-day stuff she can still get rest. So that's it in a basic nutshell. Pressure is important when it's important. The remainder of it is important, but it's less important in this scenario.
Yeah. One thing I want to bring attention to is when he said, if you're not as sensitive, you could probably do it this way. That's one thing I see a lot of times is people like, I've been through PT, I've done all these exercises, what are you going to do differently? Many times the exercise itself needs to be coached specifically for what you are dealing with in your body. And a lot of times I see that lacking elsewhere.
If you guys are looking for help, we have virtual and in-person services. All the links are in the description below. Take advantage of that webinar, subscribe to the channel, use the search bar. We have a lot of videos on groins, hips, adductors, sports hernias, you name it, man. We got a bunch of the stuff in here. We'll see you guys next time.